Do you agree that a universal single-payer form of healthcare should be Oregon's goal? And if yes, what will it take to achieve it? And from the other point of view, the Florida Court of Appeals ruled that it is unconstitutional to force everyone to buy healthcare. Some states are refusing to implement Obama's healthcare plan. Why is Oregon proceeding to implement this healthcare plan?
Let me take a start at that one. So if I got the question right, do I agree to the single source? No. Do I agree that healthcare reform should happen? Yes. I think there's a number of things we can do in our state and in our nation to both improve healthcare, improve access to care, and spend more dollars on health-oriented rather than on treatment later. I mean, it's far more expensive to treat somebody when they got the problem than it is to encourage, train, and educate healthy behavior. So I'm far to that side of the healthcare equation. You look at the things that the state of Oregon is currently doing. I spent some time with the Ways and Means co-chairs and the Health Transformation Committee just today, discussing, as an example, a $48 million federal grant request to create the IT system to handle the health exchange. So some people in the room would simply go in and say, God, it's $48 million of federal money. It's not our dollars. It's free. Let's do this. I walk in the room with a completely different attitude towards that, because I think I and many of you are paying those federal health care dollars. It's not free money. It's still our tax money. And if we don't have a concerted plan for how to create a healthcare system that works, or a health transformation system that works, we ought to be careful. I would also point out that in the short time I've been in the legislature, there's not a whole lot of resounding, successfully implemented IT projects by the state of Oregon. And I hear a couple chuckles, but I'm going to tell you, as a legislator, I could go through a list of 20 or more that just have not been tremendous success. So a person like me, I'm going to look pretty hard at that and say, how do we best spend the money? I do believe there are reforms in healthcare that the state can participate in. I specifically believe the Oregon Healthcare Plan has some elements of managed care in it that have and could continue to work very well. Some of the changes need to be in IT because, simply put, the population being served in many cases is a fairly mobile population. One day they're going to school here, and the next day they're going to school here, and one day they're getting healthcare services here, and the next day it's here. And the simple fact is we don't track that very well, and that's a huge problem. And probably one of the most expensive issues with our current healthcare delivery system in that population is emergent care. Because we don't have available, low-cost access to care, we end up with emergency room care. And an example is an Oregon healthcare patient shows up in the emergency room with an abscessed tooth, right? You think, well, they got to get treatment somewhere. Yes, they do. But when they go to the emergency room, does a physician treat them? No. Who do they call? A dentist? No, dentists don't have privileges at the hospital, so we call an oral surgeon. And this is just one example. There's a lot of them. So instead of going to your local dentist office and spending $88 to pull a tooth, or perhaps if the tooth was worth saving, having a root canal, instead we have an oral surgeon come to the emergency room, use an operatory, and you spend $2,800 to pull a tooth. Those are some of the things we got to talk about and manage and do a better job. But we've got to create access to care for that population so that the emergency room isn't their door to access.
And I would say that, you know, we have in the Oregon Health Plan a pretty unique thing. I think before Obamacare, or whatever you want to call it, from my perspective, it is how do we get an efficient system that we're just talking about. We have developed these managed care organizations in local communities that have taken on the Oregon Health Plan when big insurance companies couldn't do it. They didn't do it, they couldn't figure out how to do it, and we have groups that came together, and Douglas County has an exceptional one. We have a great one in Coos Bay. I believe the Central Valley has another one of the managed care organizations that have really shown us what we're doing. I tend to look at that $48 million and say, you know, if we can increase increase the ability for those people to continue to manage that care and to make Oregon's plan become, if they're going to have a national plan, these are monies that are given to us because we're ahead of the group. I mean, Oregon has taken this issue on and tried to figure out cost-effective ways. And if you look at some of these managed care organizations, they have been growing at 2 and 3% cost to the state over the last couple of years, when the rest of the medical field is 14, 20, and 30%. So they know what they're doing. We need to learn from those things. We need to take and figure out how to manage it. When it comes to single-payer system, I have been looking. There's a group of Republicans and Democrats in the Senate who have a very unique idea, and a very unique conservative person that I know in the lobby has been working with them to come up with a system that says, you know, and I'm not going to say this word because it's not some, I left Washington because it had a sales tax. But this group has said, you know, if we use sales tax only to pay for a health program, so that we paid it all, so there was no other, our businesses would have an advantage over all those other states in this country, because they wouldn't have to pay all that stuff. And that's an advantage that our companies fight every time they compete with Canada, every time they compete with Europe, and it's really, it irritates me that we have a situation where the costs are borne by our workers and our companies in comparison to others, and it has put us at a definite disadvantage. And so if we can figure out some of those kinds of things, if Oregon comes together, I think Oregon consistently outperforms the federal government and others in coming up with unique and creative solutions to problems. And I would love to keep working at figuring out what those creative and unique solutions are that give advantages to our people and bring new jobs and new people coming here, because this is the place that makes it work for them. So we'll look at things. I have no opinion. I think right now, I don't think we're ready for a single-payer system, but I think we can start moving towards that. And it goes back to the same things that Speaker Hanna was talking about. How do we encourage and have people use the least expensive rather than the most expensive care? And how do we get our whole population healthier? These long-term illnesses that continue to plague the United States, like diabetes and others, cost a lot of money as time goes on. And if we can stop them because they are preventable, that's the best healthcare money ever spent.
So I'm going to continue grouping these together. There's a lot of cards, and I want to be able to get as many of your questions in as we can.